Hi, this is Ken Johnson. I'm senior demographer at the Carsey School and a professor of sociology at the University of New Hampshire. And I'd like to talk to you today about my newest research looking at U.S. birth patterns and U.S. birth rates over the last year. This is based on data that was released by the National Center for Health Statistics just last week. So let me go to the screens. So I'm going to talk today about my newest research on U.S. fertility rates based on national health statistics data that was just released. You can download the data snapshot from the Carsey website. And the key point is that the number of U.S. births declined again last year to just 3.7 million births. This is the lowest number of births since 1985. So we're talking about 35 years ago. And more importantly, the number of births in the United States has diminished from 4,300,000 to 3,700,000 in just the last 8 or 11 years. So very sharp decline in the number of births in the United States over the last decade, primarily due to the effect of the Great Recession. And even though the Great Recession ended, its impact on U.S. fertility has not diminished. Now, this decline in the number of births in the United States is not because there aren't as many women to have children. In fact, there are 8% more women of their prime childbearing years between 20 and 39 now than there were in 2007. And yet we have 13% fewer births. So even with more women of childbearing age, we have fewer births. So the effect is not due to fewer women to have children. And over the course of time, the impact of this slowdown in births has been substantial. So here I'm showing you what would have happened had the birth rates of 2007, just before the Great Recession, continued. So in other words, what if women of given ages were having children at the same rate now that they were at the time of 2007? That's the upper line, the blue line. That shows how many births there would have been had birth rates from 2007 been sustained. In contrast, the red line is showing you how many actual births there are. And so you can see the sharp difference between what would have happened had the pre-recession fertility rates continued and what actually happened. And over the course of that 11-year period, we have had 6.6 million fewer births than would have been expected had the fertility rates of 2007 continued. That's a substantial number of children that weren't born in the United States. And a big question, we'll talk about this right at the end, is whether those births are delayed, they're going to occur a little bit later, or they're foregone entirely. These have significantly different implications. So we've got more women of childbearing age and fewer births sustained over a long period of time. Now, this shows you how many births should have occurred to women of different age groups had the fertility rates of 2007 continued. And I also put in the fertility rates of 2013 after the recession had really begun to have its effect. Now, both the major fertility rates, what are called the general fertility rate and the total fertility rate, have dropped sharply. In other words, women are having fewer children per woman than they did at the time of the Great Recession. Both of those rates are at record lows, the lowest rates they've been since we've kept data on this topic. The general fertility rate's down 16%, the total fertility rate's down 19% since 2007. So these are substantial losses. And one key point is that the largest proportion of births that did not occur were to younger women. You can see in this graphic, particularly for the women 20 to 24, the fertility rates for them have dropped dramatically. Had women now had as many children per woman as they were having at the time of the Great Recession, before the Great Recession hit, we should have about 1.1 or 1.2 million births to women 20 to 24. In fact, we've only had about 700,000. So this underscores a substantial decline in fertility. The fertility rates for women 20 to 24 are down 37% from what they were in 2007. That's a substantial difference. Among women in their 30s, the fertility rates have stayed relatively stable, about a 2% decline. And you can see that clearly reflected in the graph, that the number of babies born to women 30 to 34 is roughly what we would have expected. And the number born to women a little bit older is slightly more than would have been expected given the 2007 fertility rates. So the big impact of the downturn in fertility is for younger women. And in fact, among teenagers, the fertility rates have declined by over 60%. Now, many people see this as a good thing because younger girls really are not as well prepared to have children as their older sisters would be. And they tend to have, there's more poverty among babies born to these younger women and other health problems related to that. So it's probably good news that the number of babies born to 15 to 19-year-olds is diminished. But the striking declines in fertility to 20, 24-year-olds and also the 25 to 29-year-olds is quite substantial. Now, these fertility declines have occurred across all racial and ethnic groups in the United States. Fertility to young white women, non-Hispanic white women, dropped by 32% between 2007 and 2018, down 33% among Blacks, even more among Hispanic and Asian women in their early 20s. Now, again, you can see the same pattern among women in their 30s. Their fertility levels have generally stayed relatively the same, up a little bit for Black women and down a little bit for Hispanic women. But again, this drives the point home, one, that the fertility declines are occurring across all racial and ethnic groups in the United States, and number two, that those fertility declines are primarily focused on women in their 20s. And as we might expect, with lower fertility rates among women in their 20s, we actually have more women who have yet to have a child than we would have expected to have given the pre-recession fertility patterns. There are almost 3 million more women who have yet to have a child who are in their prime childbearing years of 20 to 39 compared to what we would have expected had we had the fertility patterns prior to the Great Recession continue. And in contrast, we have fewer women who have a child, who have only one child, and certainly fewer have two or more children than we would have expected. So as the number of childless women has increased, the number of women who have had children obviously would diminish. And so what we're seeing are striking differences in the fertility patterns in the United States. And this has been sustained now for 11 years. So this is not just some short-term effect of the recession. The impact is continuing now. We have the lowest fertility rates we've ever had on record in the United States right now. So a key question is whether these babies that have yet to be born are just delayed and women are going to have them later, or whether they're not going to have the children at all. If they don't have the children, again, we're talking about 6.6 million children that we would have expected given pre-recessionary fertility patterns. That's a substantial number of children when you recognize that typically the United States has a little less than 4 million births a year. So a key question is, are those babies delayed or are they not going to come at all? We don't have much to compare the situation today with except the Great Depression itself, which happened in the 1930s. And in the women who were in their early childbearing years, in their 20s, during the early part of the Great Recession in 1930, 20% of them never had any children, and another 20% had only one child, which was very unusual for that time period, and still represents the lowest levels of childbearing that we've had in American history. So, and all of this is occurring before the onset of the virus has occurred. Now, the virus is starting to occur in 2020, as we all know. It will not have very much effect on the fertility patterns in 2020 because most of the babies that will be born in 2020 were already conceived by March and April when attention to the COVID virus really began to be noticed. But next year, my expectation is that in 2021, fertility levels will drop yet again I'm sure many women are simply going to decide that the middle of a major pandemic is not the time to have children. And so the fertility declines that we've seen so far are likely to be continued in 2021. Now, these fertility patterns have long-term implications for healthcare providers, that is, especially those related to children, pediatricians, OB-GYNs, the delivery areas of hospitals. Soon it will have impacts, or is already having impacts on the school system. There'll be fewer classes needed if there are 600,000 to 700,000 fewer children being born a year. It affects all the industries related to children, the diaper industry, the baby food industry, the toy stores, all of the things related to children. And eventually it will have an impact on the labor force. So these are not small differences. These are substantial changes in fertility patterns in the United States, which have been continued over a long period now, almost 11 years. So this big question is whether those children are going to eventually come or not. If you want more information, you're certainly welcome to read my research piece, and you'll get references to several research pieces that I wrote earlier. Thank you very much.